ladies and gentlemen, dear friends. My name is Vasil Hovi. I am the hand transplant patient from Innsbruck, Austria, and the founder of the Voice of VCA Patients. Welcome to the interview. Today, our guest is Professor Martin Iglesias Morales, a pioneer in the field of reconstructive plastic surgery, especially hand transplantation in Mexico and Latin America. Professor Eglesius is the head of the plastic surgery department at the National Institute of Medical Science in Mexico City. Under his leadership, the first double hand transplantation were successfully carried out in Mexico in 2012 and 2015. These surgeries placed Mexico among a few countries in the world capable of performing the transplantation of external organs. Good morning, Professor Iglesias. Nice to see you.
Good morning. Good morning, Vasily. Thank you. Thank you so much for your work. And I agree with this job. Continue, please. Talk.
Yeah. Professor Iglesias, you belong to the visionaries in the field of VCA, not only in Mexico, but also in Latin America. As every visionary, you had to convince a lot of authorities, institutions that starting the hand transplant program at your hospital would be essential not only for the plastic surgery, but many other medical fields. Professor Iglesias, how hard was it for you to start with the hand transplant program at your hospital? And what made you think that the hand transplantation is necessary for your country? Could you tell us, please?
Well, I suppose that it was so hard as any other kind of country because this is a new field, this is a new important introduction in new techniques and new medical concepts. It's a very important. But well, here in Mexico, it was so difficult because the authorities are so close. They are not open to health, to take the new technologies, the new advancement, because it is a relation with money. And all the countries, mainly in developing countries, the money is a great problem.
Yeah.
So the Mexico and Latin America has the enough money to the main health problems like diarrhea, like gastroenteritis, like pneumonia, etc. So although we have a lot of patients with upper extremity amputation, that is not a priority health problem. But I am living with all these kind of patients since my early 30 years, 30 years, when I was working with replantation and reconstruction, and I saw this to this patient how they lost his quality of life, how they lost his job, how they lost his family, and when I saw the first hand transplantation in Lyon, France, I said, this is the solution. This is a good advancement, medical advancement. So in this, since that time, I started to fighting to implant this program in Mexico. Was so difficult because first we have to change the sanitary legal law, so the general health law in Mexico to include these kind of problems. And second, how we can obtain upper extremity or face organs with purposes to transplant. So this was very long job. I am telling you, more than 12 years until until the authority accept the this kind of transplantations, this kind of organ donation, tissue composite donation. So finally, in 2012, we can perform an upper extremity transplantation, and then after other, but suddenly the authorities cancel the program, and we are now fighting to reopen this program. This is so difficult, and I suppose in every country it's so difficult because it's new concepts, new surgical strategies to improve quality of life, and I suppose it's in everywhere.
Yeah, it is difficult to implement everywhere. Yeah, you are absolutely right.
Yeah,
Professor,
yes. Yes, tell me.
may I say that your patients were your motivation to start with the hand transplant program in your country, so to say? Can we say this? Your patients, their
Well,
problems, their injuries, their life was your motivation to improve. You wanted to improve their quality of life of your patients. That was your motivation for starting the hand transplant program in Mexico, so to say. Am I right?
yes. The motivation of the patients. Imagine, I suppose, one patient without upper extremity 1 or 2 upper extremity extremity amputations. They are in the they are uh, hidden to the society. The society cannot see this kind of patient. Everybody wants a hand. Everybody wants. If they lost a hand, they want a hand. That is my impression. They want, but they don't have enough knowledge about this procedure. They look the knowledge, and then after they know that they need money to perform this kind of procedure. So the motivation is so important. Everyone want to be complete as a normal person, as a
Yes,
normal individual,
yes.
but it's not enough the motivation. We need the help of all the society. But I can understand. I cannot understand why my specialty, all my plastic surgeons from Mexico and orthopedics from Mexico, they are not involved in these new strategies. They prefer uh, uh, to do breast surgery,
Yeah,
face surgery,
yeah.
bottom surgery, and they don't see this social problem. Also, the orthopedics, they prefer to do a surgery that represent money, and they can see the social problems. We have few people with this interest, with this motivation, social motivation. I cannot, excuse me, I cannot push this motivation into all my
Colleagues.
partners,
Yeah.
plastic surgeons, but I can do it in young people. Now we are almost 60 medicals, doctors who are involved in this program, are all of them are convinced that this is a good program, and we can help the patients with or without help of the authorities. Now we don't have the help of the authorities. They told me, do it, but you get the money to perform it. So I am I am fighting for get the money. Well, I hope to perform upper
Professor
extremity
Iglesias,
transplantation
Professor
in
Iglesias,
few months.
excuse me, please, for interruption. I would like to ask you about your plans a little bit later. May I? Yes, sir. It would be interesting
Yes,
to talk about it a little bit later. Let me ask you one more question. Professor Iglesias, you have mentioned it that the first hand transplantation were conducted in France and in the US. And do you, in your
yes,
work, rely on the experience of your foreign colleagues, or did you develop your own approaches starting the hand transplant program at your hospital? And how helpful is it for you in your work, the international meetings such as ICVCA and cooperation with your foreign colleagues? Could you tell me about this, please?
yes. Well, this kind of meetings, International Society of Vascularized Composite Allotransplantation, are so very important because the few people interested in this topic are joined in the same time, in the same location, and they share all the knowledge about this topic, the new strategies, the problems, the complications, and for me, has been very important to assist to this kind of meetings. I in these meetings, I knew to all the professors, Simon Tybalt, Pedro Cavadas,
Mhm.
Professor Lantieri, Professor Magritte, Professor Gumin, all these important people, pioneers people, and they motivated too much to me. Let me tell you, I saw this kind of man as semi-gods, something so important.
Mhm.
They are they are so very intelligent people,
Mhm. Mhm.
very very good dexterity, hand dexterity, and good social vision.
Mhm.
So it's incredible. I said to my students, you
Mhm.
must to see that kind of doctors are
Mhm.
incredible. All that they said, I pay attention, and I have learned a lot from them.
Mhm. Professor Iglesias, you have mentioned that you are going to continue your hand transplant program. May I ask you about your plans? Are you going to conduct the one more hand transplantation, or are you going to conduct other types of VCA, for example, face transplantation, abdominal wall? Could you tell us a bit about your plans, please?
Well, our team is working to perform the first face
Mm-hmm.
transplantation in Mexico and Latin America, and well, we have to we have two patients, and unfortunately we can't do it the procedure, but we are now studying a patient. Face transplant now is a big challenge because, well, it is performed in other countries, but in
Mm-hmm.
Mexico and Latin America has been not possible. Well, we are trying to do it. The other kind of composite tissue allotransplantation that we have in mind is the abdominal wall,
Mm-hmm.
because we have a lot of patients with um, uh, problems in abdominal wall. So
Mm-hmm.
we are working also in that topic, in that type of transplantation. So
Mm-hmm.
face and abdominal wall.
Mm-hmm.
Uh,
Professor,
yeah.
Professor Iglesias, you have also mentioned the problem of donation for VCA. I would like to ask you, how difficult was it for you to find an appropriate hand donor for your hand transplant patients? Do you need the family consent in this case? How does it look like in reality, in practice, donation for VCA in your country?
Well, I was talking, I am telling you, 15 years ago with Pedro Cavadas, and I don't remember other else about donation in Mexico, when we were planning to perform the first upper hand transplantation. And he told me it will be very difficult in your country because your country is a very, very conservative society, and so on. But let me tell you, the Mexican society is so it has a great generosity. For us, it had not been a problem, the donors. In the first patient, the donor was fine in 6 months, but before the patient had been rejected 2 donors before. And the second patient, 1 month, not to find a donor, upper extremity donor, and to face, well, we have an intent or transplantation, and we found a donor in 1 month, face donor in 1 month. So I believe that the Mexican society, with information about the problem, is a great society, and has not been a problem to fighting with the donors. The donors, the families are so grateful. So I don't. My problem is not that. My problem is the money and the authorities. And the health authorities. The health authorities is my problem.
Professor Iglesias, and it would be very interesting to know, how did you meet your first hand transplant patient, Mr. Gabriel Granados? Did he match your idea of a perfect recipient? Tell us about this, please, about your first meeting with Gabriel.
Excuse me, during the surgery, excuse me, I understand that I told you about Gabriel Granados, his surgery. Well, his surgery was.
How did you meet him? How did you learn about
Gabriel?
Yeah.
Okay, Gabriel. Well, I was developing the program in Instituto Nacional de la Nutrición, and we have some 2 or 3 talks in other hospital. Well, the family, the Gabriel's family, heard about the program, and his wife, the Gabriel's wife, heard this, and when his husband had the problem, the problem, she was where to our hospital to ask for information. So we gave the information, and Gabriel was at the hospital still. And when the Gabriel was out of the hospital, were to the our institution, and we were enrolled in the program. We studied psychological, psychosocial, medical, and he was a very good candidate. And so we performed the transplant. What's the first? But let me tell you one thing, Vasily. Before Gabriel, 2 years before Gabriel, we performed upper extremity transplantation in a girl from 17 years. 17 years, and this patient died 19 hours after the surgery by a stupid mistake. And the stupid mistake was the induction. The thymoglobulin was applied into 20 minutes instead of 8 hours, and she developed an syndrome, cytokine, massive syndrome, cytokine release, and well, the patient died. So when Gabriel get to the hospital, arrives to the hospital, everybody said to Gabriel, no, don't do it, because Dr. Iglesias performed performed before an upper extremity transplantation, and the patient died. So you have 100% to die at the procedure. So Gabriel initially was afraid,
Afraid, yes.
afraid of that, afraid of this information, and was undecided about the procedure. But finally, he decided, no, I don't believe that Dr. Iglesias is 100%. I believe in Dr. Iglesias. I believe in the team. I will do it. And he do it. Yes. Well, this failed. This patient, the first patient that died, was an important drawback for us. Everybody told us many bad things. He told us that we are not prepared of this kind of surgeries. Mexico has not been in good situation with these surgeries. Many bad things, but fortunately, we performed the second and the third patient, and I hope to perform the fourth patient in few months ago.
Professor Iglesias, I would like to ask you one more important question. You have already mentioned it. We have already started talking about your colleagues. It would be very interesting to know, how did you build your team for the hand transplant program? Were all surgeons, nurses, therapeutists, immunologists from your institution, from your hospital, or had you to invite the staff from other Mexican hospital clinics,
Yes.
or where necessary, maybe where specialized trainings required, or could you do it on your own?
Yes, mainly the most of the members of the team are from our hospital, but may but others are from other hospital, are a friend of mine that we work sometimes in other cases, and they know me. So that was in that time, but now we are out of this institution. Now are only in private medium, because the authorities cancel the program into the public health institution. So now they told us, you can do it, but only in private medium. So now our team is from many other hospitals, many other clinics, and well, it was a little more difficult, but we can do it.
Yeah, so, perfect. Professor Iglesias, I think it would be important to say that the first hand transplantation was conducted by Dr. Valdivia in Ecuador. It belongs to Latin America, yes, and in 1964. The graft didn't survive because of an official immune suppression therapy. I would like to ask you, have you ever met Dr. Valdivia? Maybe some of his colleagues, or not? It would be very interesting to know.
Well, I don't know the name. No, the name of this surgeon is Gilbert, but I don't remember the second name. But Valdivia is not. It's not Valdivia. It's Gilbert. Okay, I'm going to remember. He's from Ecuador. Is
Yeah.
right? 1964.
Yeah.
Well, I went to Ecuador
Mm-hmm.
to to find him,
Uh-huh.
to meet him.
Uh-huh.
Okay, but it was not possible because the doctor is dead.
Uh,
Yeah,
mm-hmm.
is dead at that time. Is dead, and I will try to talk with his son. It's the
Mm-hmm.
same name of it's the same name of his
Mm-hmm.
son, and he's working in the same clinic that his father,
Mm-hmm.
where the hand transplant was performed,
Mm-hmm.
and I couldn't. It's not a it's a very difficult person. His son was a very difficult person. He asks me many things. It was impossible to meet with him. So
Mm-hmm.
through a friend of mine in Ecuador, I asked him, please help me to do a meeting with
Mm-hmm.
Gilbert's sons, but it
Mm-hmm.
was not possible. It was not possible. But
Mm-hmm.
it was a great advancement in Ecuador, but not as now, because in that time there was not protocol, was not uh, medical pre-evaluation,
Mm-hmm.
social psychosocial pre-evaluation
Mm-hmm.
was suddenly.
Mm-hmm.
Well, for me as well, for the ethics, it's not well done, but it's okay. But it's an important historic date.
Yeah.
Mhm.
Professor Iglesias, you have mentioned it, yeah, immunosuppression protocols. In your opinion, how much improvement do immunosuppression protocols, post-transplant care protocols, how much improvement do they need? And can we patients hope for any improvement from your point of view?
Yes, well, now I am using the standard immunosuppression
Mm-hmm.
protocol, triple triplet drugs, tacrolimus,
Mm-hmm.
MMF, and steroids. But yes, I hope that the immunosuppression therapy improves, and it will be do it. Everybody is working in that topic, and I hope that could be soon. We will have news, and the patient, well, will be benefits will
Mm-hmm.
be received a great help with this modification in his treatment. So
Mm-hmm.
yes, I hope the immunosuppression will improve. Mexico is not working in this field because don't have money, but the developed countries are working in that topic.
Mm-hmm. Professor Iglesias, as I already said, you are the pioneer in the field of VCA in your country, in Latin America. How do you see the future of vascularized composite allotransplantation in your country and Latin America? Could you share us with your knowledge? How do you see this?
A good question, Vasily, good question. When I am alone, I put the think about this, your question. What is the future?
Mm-hmm.
Really, I am uncertainly about the future. Uh, I I think, in my personal opinion,
Mm-hmm.
that DCA in Mexico will be developed in 20 years ahead. 20
Mm-hmm.
years ahead, a lot of money, a lot of time, because, well, number one, we need change in our authorities. We need change in our academic authorities. We need change in the social economical medium, because our doctors are looking money. So that problem we must be changed for
Mm-hmm.
our doctors looking the social objective, a good social objective. So in 20 years, maybe the VCA in Mexico will be a, a, a reality. You can go at one hospital and you will be involved in a program of hand transplant, abdominal transplant, face transplant, and other kind of VCA. But now I don't believe it will be easy. We need to will
Mhm.
continue working, and I would like to form another team in another part of our country, but it's so difficult, Vasily. And I suppose in every country it's difficult. In your country, it's difficult. Although
Difficult,
your country is
difficult,
developed, it's
difficult. Yep.
difficult.
Yeah. But Professor Iglesias, you have laid the foundation stone of the hand transplantation in your country. I'm sure your work will be continued by your colleagues. Professor Iglesias, finally, I would like to ask you one more question about our patient initiative. In your opinion, how it is important for VCA patient, for hand transplant patient, for face transplant patient to see each other, to learn from each other, to support each other? Uh, do the patient benefit? VCA benefit from the communication with each other. How do you see this? Is it a good idea?
Incredible. No, it's not a good idea. It's more that good idea. I don't know what more a good idea. It's the most important thing that I have seen apart from the medical advancement, because psychosocial that your work is doing is incredible. You can interchange information between the patients, and only you as a patient can motivate another patient, not the doctor. The doctor can say the true or maybe false information, but you said the truth. Don't believe in that. Perform this and do this and move here, etc. It's incredible your work, and it's so important. The relationship between all the patients, it doesn't matter the country, is so important. Congratulations for your work. Continue. And all your patients, you and all the rest of patients, push out to improve the results.
Yes, yes, you are
Thank
right.
you for
We will
your
do
work.
that. Professor Iglesias, many thanks for your time, for supporting our initiative with your talk. I'm very grateful to you for everything you do for our initiative, for help with your other patients. And I wish you success and only success in your difficult work. Many thanks, and I hope to see you next time at the other meeting. I will not keep
I
you.
hope to see you soon, Silly.
Yeah, yeah. Many thanks.
Take
Yeah,
me in account and all.
thank you very much. Yeah, I will do this. Yeah, Professor Iglesias, I wish you a wonderful day, and I will keep you informed. Uh, Many thanks, and see you.
Thanks to you. I'll see you soon.
Yeah.
Bye bye.
Bye bye.